Hi everyone and welcome to Techweek TV, brought to you by Callaghan Innovation. We're delighted to have you joining us this morning. Today we're going to be talking about the role of technology in the future of health, and we've got some amazing people joining us this morning. Leighton Duncan, co-founder of Sense Medical, Kieran Holland, clinical lead at Streamliners, Thorsten Engel, partner at Deloitte, and Belinda Allen, Client and Partnership Director at Orion Health. And just so you guys know, at 10 a.m. we'll also have Stella Ward, the Chief Digital Officer for the Canterbury DHB. Will be popping in about half an hour. So we're going to kick off with some presentations. I'm super excited about them, you should be too. And over to you, Leighton.
Thanks, Jan. As Jan said, my name is Leighton, and I'm one of the co-founders of Sense Medical. And our mission at Sense is really to transform how clinicians access, create, and communicate clinical information. And we do that today with our product Cortex. This is an iOS application, back-end service, and communications tool for clinicians and caregivers. And that group of caregivers and clinicians includes a huge number of people. When you count the number of people involved in a single patient's care, it's a sizable team, and each of them are working with a dozen or more patients at once. And these have historically been the tools of communication. And by and large, we've replaced the pages and fax machines with desktops and phones, but the paper remains ubiquitous. Clinicians will get their printed patient list at the beginning of the day, and they'll note tasks and track progress by writing next to the patient's name on this piece of paper. So what we're doing with Cortex is eliminating all that paper and replacing it with an iPhone or iPad application. And so Cortex is our mobile application, messaging, and server-side solution that provides clinical teams the tools to seamlessly access, create, and communicate around their patient's care. Moving from a piece of paper held by one person to an electronic record that everyone can see reduces the delay and errors associated with these traditional workflows. So Cortex sits at the heart of a clinician's workflow. And all these clinicians here need to access so many different systems on the go. And each is provided by different vendors. So for example, the LIS, which is the lab information system, may be separate from the patient management system, or the PMS, or the core EHR, and that's the electronic health record. So Cortex gives a single optimized view and access point into these various hospital systems, and it's integrated with the clinician's task and note workflow. And so this allows them to work efficiently and carefully at the bedside, or wherever else they need to be in the hospital or beyond. And so anytime Cortex is online, it's intelligently syncing with the hospital's authoritative CDR. That's the clinical document repository. For example, Orion's Concerto product. And our documentation engine allows everyone to generate high quality, useful care documents by including dynamic SNOMED coding, rules-based visibility, content visibility, and clinical decision support tools such as health pathways from Kieran's team. And team leaders can design their own customized forms to suit their teams and wards. And finally, Cortex integrates a fully attributed commenting and messaging system that serves everyone in the team. So doctors, nurses, physical therapists, the entire multidisciplinary team. And so we've explicitly designed Cortex at every stage to make the clinician's life easier and the patient's care safer. You can think of it as a toolbox for clinical workflow. We provide team task management, clinical documentation, and patient-centric team communication. Now, I'm personally excited about the practical impact that Cortex can have, and I'd like to spend a little bit of time talking about that. So Cortex was deployed at Canterbury DHB in 2016, and in 2017, the team there established a formal validation study. And this was done in general surgery over a 12-week period, compared with the same seasonal periods from the previous 2 years. And they found some impressive efficiency gains and received overwhelming positive subjective feedback from staff. And I think we were all super pleased with these results. So we saw a 12.5% decrease in readmission rate, a 20% reduction in the average length of stay, a 15% reduction in total bed nights. And so these numbers are incredible. And what it translates to is an estimated $80,000 a month saving per 30-bed ward. So Cortex is measurably enabling CDHB to be more effective and more efficient by helping clinicians to work at the bedside and communicate efficiently. And we're super excited to see the results when the fully digital Hagley facility opens later in the year. And we're also extremely grateful to Stella, who will be joining us later, for allowing us to support and participate in this groundbreaking rollout. And just finally, we're super excited to be able to help more organisations around the country realise these sorts of goals. Thank you.
Awesome, thank you so much, Layden. Just before we go to our next presentation, what I would like to know from you is, beyond the savings and the ease of that you give to your clinicians, what's been the response, maybe more the emotive response to you making their jobs kind of easier?
I think one of the key bits of feedback that hit home for me when we got some of that subjective feedback, because part of that study was interviewing clinicians, and there was a story from one of the nurses who was dealing with a deteriorating patient at the bedside. And so one of the things that she really valued is that she had all the information in front of her. She didn't need to leave the bed. She didn't need to go to a computer system to log in to get the information she needed. She could stay right there at the bedside with the patient's family, with the patient, and have everything she needs. So when you hear stories like that, that is some of the more heartbreaking and also validating, and it makes what I do feel meaningful and
like it makes a difference.
Yeah, exactly. It's
awesome. Thank you so much. So we're going to go to Kieran next with his presentation.
Thanks, Sean. Yeah, so I'm the clinical lead for the Health Pathways platform at Streamliners. Streamliners was originally a technical writing company founded by Ian and Emma Anderson here in Christchurch. Currently employs about 100 people. These days our main focus is something called Health Pathways. But before I talk about Health Pathways, a little bit of background about me. I grew up in a medical family. Both my parents were originally rural GPs. And from a young age, I came to appreciate the challenge of general practice, that you're expected to know something about everything, and medicine's so deep that you're always feeling out of your depth. When I was 5, we moved from rural Southland to here in the Big Smoke in Christchurch, and my parents bought a practice from a retiring GP in Linwood. At that stage, they knew nobody and really nothing about the local health system. Believe it or not, there was no internet. And so when they didn't know what to do for their patients, which was most days, they'd have to use a range of tactics, from talking to their colleagues, ringing around, or sometimes just trial and error. And depending on who they talked to, they'd get different answers. So the reality for patients was that they got different care depending on the experience and knowledge of their doctor. My mum said it took her at least 3 years before she felt comfortable practicing here in Christchurch. So wouldn't it be great if, if this local knowledge were written down somewhere so you didn't have to learn it over and over again? Or it might surprise you that this was even an innovative idea. So I'm going to play a little video about Health Pathways now.
Health Pathways Melbourne is a website designed to be used at the point of care to help healthcare professionals assess, treat and manage patients, and provide local referral information. More than that, it is a process and opportunity to engage the clinical workforce, drive system improvements and patient outcomes. Health Pathways Melbourne is a platform that enables our health system to develop, share and adapt clinical care pathways to our local environment, which accelerates evidence into practice and ensures better, safer care and an improved care experience for patients.
I think that this is an incredibly innovative tool for several reasons. The first is that it provides concise medical information which is up to date and it's peer reviewed and it's been developed locally, and importantly it is GP led and written for GP audiences and the GP context.
Health Pathways Melbourne is a collaborative program run by Eastern Melbourne and Northwestern Melbourne PHN. It is supported by local GPs, consumers, hospitals, community health, councils and other health organisations. Developed for clinicians by clinicians, Health Pathways Melbourne supplements and supports the clinical knowledge and expertise of general practitioners.
The methodology is that we work strongly with our subject matter experts and with our local GPs to agree upon how we manage particular conditions common to general practice.
Health Pathways helps me personally in my practice by bringing all the bits of loose information that hang around computers and bits of paper together into one place. So it gives you reliable, consistent knowledge, and it gives you reliable and consistent sort of referral information. It's easily accessible, and it means you don't spend time hunting on the phone, waiting for people. It's just right there in front of you. For me, in a busy practice with patients with complex problems, it's magic. It just made such a difference.
So we didn't actually make this video. I found it on Google, and I'm surprised to hear Australians saying such nice things about something from New Zealand. So how did that come about? Well, back in 2007, the Canterbury health system was disconnected. It wasn't long prior that 5,000 patients had been arbitrarily thrown off the waiting list here, and it was projected that by 2020 we'd need twice as many resources just to keep up. Fortunately, there were some visionary leaders at the time who said we need to fix this, and they painted a vision of a connected health system that was centred around patients, with the goal of delivering the right care at the right time and place with the right team. And the CDHB sponsored a number of key projects. One of those was called the Canterbury Initiative, and the founding members were 2 local GPs and an engineer. And their goal was to fix the interface between general practice and hospital services. The basic approach was pretty simple. They got a few GPs and specialists in a room together to talk about a particular condition or symptom, and they asked each group what was working for them and what wasn't. At the end of the session, they'd have a whiteboard full of ideas. Now, the specialists would often complain that they got, rubbish referrals from the GPs. If only they included this information, they'd say, we could have made a better decision about whether we needed to see the patient and we might have saved an appointment. And the GPs would say, well, if only we could get advice, we would know when we needed to refer the patients. It wasn't just the opportunities that were identified in these meetings, but it was also the relationships. These GPs and specialists had often been communicating with each other for years, but they'd never met face to face. Now, some of the problems weren't easy to fix, but many of them were just about sharing information. If you do this, I can do that. So that's when streamliners became involved to document locally agreed pathways for care. So today, Health Pathways is a comprehensive online reference for general practice teams. It covers more than 600 common conditions, and it provides advice on assessing, managing and referring patients in the local health system. This is the information that my parents needed when they first came to Christchurch. So by 2011, Health Pathways was pretty well established here in Canterbury, and local GPs and nurses started talking to their colleagues. It wasn't long before the West Coast, South Canterbury and Nelson Marlborough had all started adapting the Canterbury pathways for their environment. And in 2012, the Hunter New England region in Australia said that we want to do that too. So what started as trying to fix a problem in Canterbury has now been adopted by 43 local health systems across New Zealand, Australia and now the UK, collectively responsible for the care of about 28 million patients. We help each region set up a local team to adapt the pathways to work in their environment. And looking to the future, increasingly our focus is on getting that community of people working on health pathways to collaborate and share their work. Every 18 months we bring together a conference of the community to foster collaboration. And as Leighton was saying, in the tech space, we're starting to work on APIs so that health pathways can be integrated into clinician workflows. Long-term goal is for this to remain a Christchurch-based business with global reach, and we're really grateful for the support of the Canterbury Health System. They help us stay grounded and make sure that what we're doing is relevant to patients and clinicians. We're also really grateful for the support of New Zealand Trade and Enterprise and the Callaghan Institute. And I'd say that the 8-minute version of this, it sounds like everything falls into place. Well, it doesn't. You know, every day we make new mistakes, but we console ourselves that if it were easy, we wouldn't have a job to do. So thanks for listening.
Awesome. Thanks so much for sharing, Kieran. I just want to know from you, what's your advice for other regions wanting to have a connected health system?
Yeah, good question. Look, I have a huge amount of admiration for the leaders in the Canterbury Health System. It's not that as if there's one answer to that question. It has been, you know, more than 10 years of hard work at all levels from the CEO down. But I think at the heart of it, it has been about engaging with clinicians and frontline staff to really understand the problems that they're dealing with and picking off the low-hanging fruit, because that builds trust and confidence that things can be better, and then you can start tackling some of the harder problems.
Awesome, thank you. Right, we're going to go to Belinda now. Take it away.
Hi. Hi, I'm Belinda. I work for Orion Health, and I'm going to touch on 4 key technology trends that I think are going to have a really big impact and how we're responding to those trends. So the first one is that what we've seen over the last few years is $26 billion has been invested in these sharing platforms. And these are like peer-to-peer network platforms or collaborative platforms that make the most of underutilised products and services. And so this movement towards, I see this movement continuing, that we're moving away from having monolithic products and that we're having platforms that make the most of what already exists. I think this can have a great effect on the health sector because people trust it outside the health sector that platforms work. They've transformed other sectors, and I think they're going to transform the health sector also. The next trend that I think we should be thinking about is actually, again, looking at our personal experience, is that from these platforms that are all about, have been designed, focused around human-centred design, it reminds me of how we talk about patient-centred services that we're trying to deliver in the health sector. Now, looking at our experiences with how we use YouTube, and it gives us our feeds are personalised for us, or in our booking.com or in our other platforms that we use every day, we have this expectation that actually the platform's going to know everything it needs to know about me, that's going to be accessible. And if I want to make a choice about where I want to, if I need some service or information or care at a particular time of the day, that should be available when I need it. I'm going to be quite demanding as a patient going forward, and I'm going to say that actually I'm going to be better informed, so I'm become a much more activated patient, and my voice is really going to matter. I'm going to be telling the health sector if I'm not happy with services, I'm probably going to be communicating that through social media platforms. And so I think we have to be quite cognizant of what's happening outside the health sector from a technology perspective and how that will translate into changed consumer behaviours. The next one is that the way we gather information now as consumers and patients has changed. It's typical that we will Google it first before we'll ask someone, can you answer this question for me? And what happens with that is we have access to so much more information at our fingertips. Doesn't mean we actually understand what all that information means, but we have access to it and we feel like we're in control. And we are starting to build and construct around ourselves what I would call digital walls. And what that means is that actually personal interactions may not be so important. And I think that what this translates to the health sector is that new models of care will be acceptable. The way we receive advice will be much more acceptable. If it's late at night, I'm watching my Netflix video and shucks, I've got to order a new prescription, then I should be able to do that immediately while I'm watching something. Or perhaps I need to make a booking to go see a GP or a physio that's really close to my house. Wouldn't it be great if I could do that late at night, because that takes one thing off my shopping list for the next day. So I think new models of care are going to be are really going to come to their fore, and they'll become much more acceptable in the future. So we have to respond to that really well. Now, we know that also, I think we've talked about this for some time, is that what makes someone healthy isn't just their actual looking at their healthcare measurements, it's also looking at their genetics, their economic situation, their social behaviours and how they, behavioural choices as well. All of that information makes up who I am as an individual. And with that is that means that's a whole lot more data points that we have to capture and then interpret. And so that's really important for us as technologists, is that we have the capability to be able to not only capture data, store data, reuse data, but actually provide some sort of support for decision making on top of that. So how is Orion responding? Well, for the last 26 years, we're a New Zealand company. Some of you may not know, we have offices in Christchurch and Auckland and satellite offices in Wellington and Hamilton. Our goal has always been that we're going to revolutionise global healthcare so that every individual receives the perfect care for them. It's a pretty lofty goal. We started out a long time ago saying we've got these disparate places where information is stored. How can we surface that so that people can make better clinical decisions? Since then, we've moved into a space of advancing population health management, and now we move into the precision medicine platform, building platforms for precision medicine as well. So we're trying to stay ahead of the curve and say, actually, people want to go from receiving reactive care to preventative to predictive care. And we've got some fantastic examples from around the globe, but let's focus on New Zealand, as New Zealand really is at the vanguard of saying, hey, we've got 20 DHBs. That's a lot for one country. We'll chop that up into 4 regions. Okay, that's probably still quite a lot. But within each of those regions, they're doing fantastic things around trying to join up services and provide a more personalised service for patients. That's always going to be evolving. In the South Island, we've got 5 DHBs that are already linked up all of their primary care and secondary care data to try and provide, if I'm coming from Invercargill, which is my hometown, you probably hear it, and then I go to Nelson and I have to visit the hospital there, is that they'll be able to see my information, and that's going to mean that I'm going to get better patient outcomes. In the Northern region, they're really doing fantastic things of joining up information also. For a long time, they've been building and evolving their e-referrals management system so that referrals electronically can pass from primary care, from GPs through to the DHBs and between the DHBs. So that's a great story too. Midland has a fantastic story. So we're talking about the Waikato out to Tairāwhiti, Taranaki. What they're doing is they're saying, we are one region, 5 DHBs, one region. We have, for each patient, they're going to have one record. So they're on a long journey to bringing all this information together through this platform so that then clinicians can make better decisions. And hopefully in the future, then we'll add some predictive analytics on top of that. But it's the vision they have for saying, actually, the right thing to do is to work as one team, even though we may physically appear as different organisations and agencies. One last thing I want to touch on is that for Orion Health, we're moving into and supporting precision-driven health. And the way we've done that over the last few years is in a public-private partnership with the Ministry for Business, Innovation and Employment. PDH is all about saying New Zealand is putting a stamp on the globe and saying we are going to put together data scientists with clinicians, with technologists to be able to develop some predictive tools that are going to help take all that tsunami of data that we're talking about and turn it from knowledge into understanding. And a great example of this is what Auckland DHB has been part of, is they've built a surgical risk calculator. Now what you see here on the graph is, what we've said is that previously, if you wanted to know what was the likelihood of your survivorship after a surgery, we would probably use the SORT model, and that's that orange line on the graph there. That SORT model used data from patients that lived outside of New Zealand, so it wasn't tailored to a New Zealand demographic. What our data scientists did, working very closely with the anaesthetists at ADHB and the University of Auckland, they said, we're going to take a whole lot of data, historical data, population data from New Zealand, and we're going to build a risk calculator that's far more accurate for our population. And that's what they've done. So you can see there we've got the perfect prediction running up through the middle of that graph, and NZ risk model is saying it's really closely matching that line to say that now I can enter in some data and I can say what is the likelihood that I'm actually going to survive and how long I might survive after the surgery. And the benefit for me as a patient is that I actually can have a better informed decision with my clinician. So that's where we're going. That's where the world is going. Everything's got to be much more predictive. People have got to know me, and that's the direction we're travelling in at Orion Health.
Awesome. Thank you so much, Belinda. Quite illuminating. The question I have for you, and it might be a bit of a curly one, I'm sorry. People are the users of the health system, and what goes on behind the scenes no one has no idea about. And so we are very vocal, but sometimes we're not very informed when we are vocal, which means often it's a little bit out of context, I think, for what's actually going on. So what I want to know is consumers tend to want more of an experience similar to, G Suite or getting your Google Docs in the cloud, the easy to use, where they can just go and do that. And in practice, how is it creating that seamless experience as a technology company in the back end and then integrating that with an entire health system that's got so many moving parts?
So I think, was your question, how is a patient going to...
So, I mean, my question's more around for you, the people creating the platforms that people actually have to interact with. What's the reality of actually making that seamless experience?
What's the reality of making that seamless? Well, I think if it's from clinicians who we primarily are building technology for, is that we introduce them into our design process through and so when we develop any new product, we go out and we do a lot of primary research and we try to understand what are the problems that they're facing, and then we try to create solutions that actually will address those problems, but we have to do that in an iterative process. And ideally, if you have really identified what is the crux of their need, and then you've gone and observed gone out and observed the challenges that they're facing, you can actually build a product that meets that need, and so you have that seamless solution, I suppose, rather than building in isolate. The alternative is to build in isolation.
Awesome. I've never heard data described as a tsunami before either, so that was quite amusing.
Billions of data points.
Okay, we're going to go over to Thurston now.
Good morning, and thanks for having me on the program. I work for Deloitte, which is a global consulting firm. We have about 12,500 people working globally in healthcare and life sciences. And I've got the privilege of sharing with you some thoughts that I can't take credit for, but that some of our brainiacs have come up with around the future of health. The first point to make is what's actually going on with regard to innovation. And we've been involved quite heavily with the XPRIZE Foundation, so that's given us a front seat at how to make innovation happen, but also what's coming through the innovation pipeline. And if you look at the chart, it's clearly an exponential picture, and that makes it very difficult to predict how innovation is going to impact your world. If you look at Facebook, for example, it was only launched in 2004. And since then, we've had 2 innovation cycles, so roughly 2 lots of 7 years. We have 2.3 billion people on the planet using Facebook, so roughly 30% of the world's population is on Facebook, and obviously clearly impacted by social media. There's no way you could have predicted that with the normal sort of linear approach to predicting the future. So the first thing about predicting the future is it's really difficult, and it's definitely exponential and disruptive. I think the other thing to consider is the speed of innovation. It obviously runs at a much faster pace than healthcare is comfortable with. So these massive disruptions to the health system can be quite challenging. We've had Australia recently announce an $80 million grant to actually set up a CAR T cell therapy treatment center in their jurisdiction. It was only approved by the FDA in 2017, so it shows you that even in healthcare we can move very rapidly to adopt technologies. The other big pivot that everybody talks about is moving towards holistic healthcare. So if you define health as an overall state of well-being and spiritual wellness, then the picture really changes, because what we're currently geared up to deliver isn't quite set up for that purpose. If you look at the right-hand side of the diagram, a lot of what we do today is assess, treat, repeat. Assess, treat, repeat, and we spin through these loops. We've created these little bastions of power, so you've got hospitals over here and primary care over there and NGOs over there delivering their respective treatment and assessment programs, but it doesn't quite come together and give a holistic experience for the patient. The other challenge that we have is that the bulk of our burden is actually non-communicable diseases. They don't respond very well at all to this sort of model. And nowhere is this more apparent so than, for example, in mental health. Our youth suicide rates are appalling, and I think, from memory, around 44% of people who've chosen to take their own lives had some sort of interaction with the health system before doing so. So that tells you that assess, treat, repeat just doesn't work. So for these lifestyle, chronic condition, asthma, diabetes type things, we have to actually pivot to the left-hand side of the equation. And that means real interventions during the daily lives and allowing people to live the best possible lives that they can lead, with nudging and support out in the community and really influencing the social determinants of their health. So if you buy into this model, it's about real proactive intervention and coaching people to lead better lives. A bunch of things have to be true. For one, we have to share our data, and you will attest to how difficult that is, and you've had those experiences as well. Data sharing is quite often one of the first barriers that's thrown up. But if you sort of look at the technology is not actually the excuse. I mean, Apple is able to link to 500 different hospitals already. You can have your own personal health record with Apple. If you're a North American tourist and you happen to interact with our health system here in New Zealand, you'd be expecting your ED details, your chest PA X-rays and everything else to be uploaded to that record. Obviously, we would struggle doing that. As an empowered consumer, you would also expect to have the rights and the control points over your data. We're seeing a lot of students in the Netherlands at the moment actually monetizing their data. So they're very happy to wear the Fitbit, the Garmin or the iWatch, and essentially trade all of the data points of their daily lives or even the medical interventions that they have for free cups of coffee or free meals at the cafeteria. We sometimes inadvertently trade our data when we download yet another application from the internet and maybe don't realize that that health or wellness app is sharing data with a third party who in turn is monetizing that through a consortium or something like that. So we do want to nudge people and we do want to influence their behaviors, and most of us will have friends who have a Fitbit or a watch or maybe wearing a ring or something and can tell stories about somebody who's slept better, maybe watched their diet, maybe watched their exercise a bit more, maybe reduced their drug and alcohol consumption. So what does technology need to do to allow us to do that? And this is a model that we use to then help organizations figure out what some of these strategic choices are around their future in the healthcare system. So if you wind the clock forward, the real disruption in healthcare is highly likely to come outside the public health system as opposed to coming from within it. And you recognize a couple of those stereotypes, or if you will, the roles on the left-hand side. You've got the classic data platform providers, the Azures, the Amazons, the Apples, the Google Analytics platforms of the world. And then in the middle, this is actually where the really interesting stuff is happening. In the US, we've seen Aetna acquire CVS. So Aetna is a large health insurance plan and provides a comprehensive set of benefits to all of their health members, with millions and millions of members. And CVS has 10,000 odd stores across the United States. CVS is now branded as a health business, so they've taken tobacco off the shelves. Now they can link your health plan data with your behaviors and moments in the store. They can offer you the 1-minute nurse check-in. They can offer you a medication review with the pharmacist in store, and suddenly really help you make day-to-day choices. They know not to promote the peanuts to you because you have hypertensions, and they know not to promote the chocolate bars to you if you happen to be diabetic. So that really changes the game around the experience that you can ultimately create for somebody. And on the far right-hand side, so the green boxes, if you will, on the diagram, this is where our supply chains will see quite a bit of disruption, because everybody is geared up towards getting things in and out of a hospital or in and out of a local GP or community practice, and we're very location bound. But in the future of health, if you're really wanting to deliver the next best nudge or the next best action to a consumer, you have to be present in their lives and where they choose to be. And that means your supply chain has to change. I think the last point to touch on is the finances. Everybody knows the problem of the wrong wallet. So I do the right things over here, but the benefits land over there. So the way insurers and governments adjust to how we monetize, commercialize, and incentivize the right behaviors is also going to be really important. So I hope that's given you a glimpse of some of the disruptions that we might be facing in the future, and thanks for listening in.
I think that was a really wonderful overview. I'm not even sure where to go in there because there's just so much packed into there. I think I'm going to focus on the more preventative side because it's not really something that's kind of rolled out in that system or in our current system, as you've mentioned. What are some of the practical things that we can be doing in the preventative care space in New Zealand?
So the preventative care is really driven by the day-to-day choices that you make, and Kaiser in the US is a good example of. My apologies. Back to the microphone. Preventative care is a great sort of example, and I think if you look at Kaiser, for example, in the US, if I'm a Kaiser member, they will prompt me if I haven't had my medication review or my regular hemoglobin A1C check and a bunch of other things. And they will actually notify me on my iPhone if I'm walking by a pharmacy or a local retail clinic that's happy to do that. If I step into that clinic, just to do my one-off annual check, they will also at the same time say, oh, by the way, I'm sorry I can't role play this one, but if, for example, I was overdue for a breast scan or something like that, they'll encourage me to maybe have that done. So they will serve up all the right actions for me at that point in time in my life. And they do that by just knowing me, knowing what it is I need and what is the next best action for me in my daily routine at that particular point in time. So that's very tangible and it is very real. And I think, the simple stuff like the wearables, you commented earlier about the tsunami of data. People used to worry about somebody walking into the GP and saying, I've read this thing on Google and I think I have the XYZ disease. Now they walk in and say, I had a bit of chest pain yesterday and the last time I played footy, and here's my Fitbit and here's my Garmin. Can you look at my last 72 hours worth of data and help me figure out whether I should be worried? We're just not equipped for that, but the consumers are.
It makes for an interesting model of what does the future of a doctor's office or a GP clinic look like? Will you maybe have a data scientist just sitting there, maybe, potentially, something in there, someone looking at your data. Okay, we are going to now welcome Stella Ward to join us. Thank you so much for being here.
Thank you.
Okay, and now we're going to ask some questions. If you guys at home haven't figured this out, you've got a pretty awesome lineup here, and I think when I was reading all your bios and researching, it seems to me, personally, quite naive in this space, that you don't often get so many sides of the table in the room and working together. That's something that kind of struck me as pretty interesting. Just for those people who don't know what a DHB is, Stella, would you be able to sort of explain that and why it matters?
Sure. So a district health board, there's 20 of them in New Zealand, and they are responsible for the health and well-being of the population for that region. And that means that we are responsible both for the planning of the services, the funding of some of those services, contracting out some of those services, and also the hospital services in terms of service provision. So a district health board has relationships with the private sector, the primary healthcare organisations, the non-government organisations that might have contracts, all of those entities in a coordinated way serving the population from a health and disability and wellness perspective for that community.
And where does that sit in within government?
So we're a Crown entity, and so the relationship is with the Ministry of Health in particular, but we also have a relationship with the Minister of Finance in terms of our annual plans are signed off by the joint ministers. And New Zealand has a public health system, so most of our activity is funded by our taxes via the government.
Awesome, thank you. Okay, so a bunch of questions here, and I would like an answer from all of you, so maybe Belinda, we can start with you. What technology and its impact on the health sector are you most excited about in the next 10 years?
So I think that for me the most exciting will be that we have those virtual care teams will be developing, and we'll have technology that will support people to be like when Torsten was saying about you look at someone's well-being, that's their spiritual health and well-being and their mental well-being, is that wouldn't it be great if, even though we have all these different agencies that are there to support an individual, that they have the technology to be able to work as a coordinated team. And I think that's going to come and have a huge impact.
I think there's two things, and they kind of go hand in hand over the next 10 years, and I think we've touched on it quite a bit already. Wearables, for example, and that continuous monitoring of some basic health information combined with machine learning, and I'm really hesitant to bring that up because I think there's been some really irresponsible promotion of the capabilities of machine learning and AI. But over the next 10 years, I think those systems will, I think there'll be more understanding around failure modes, which is really important in safety critical systems. And you look at the stuff that Apple are doing with Apple Watch and Research Kit and Care Kit, and being able to easily commission clinical studies where your sample size is in the tens or hundreds of thousands versus hundreds, and that can dramatically change the outcome of research and provide more accurate research. And you already see the impacts of some of that Apple Watch stuff in predicting heart conditions and alerting people to the onset of heart attacks, and they can get care before things are too dire. So I think those two kind of go hand in hand, and over the next 10 years are going to be a really important part of healthcare.
Awesome. Torsten?
I'm going to go out on a limb here, but I think I'm less excited about all the new technologies because they come up all the time. But the fact that we are now paying our health workers a decent wage, and the strikes and the workforce issues that we have will force us to acknowledge that we need to invest in productivity. New Zealand has kind of coasted along by throwing more and more people at the healthcare system, and we all work in IT, and we know IT has been underinvested in, and I'm hoping that the bungee cord is now stretching hard and far enough so that we actually are brave enough to break the mold and make more substantial investments in technology to change the model of care and to enable newer ways of working.
Interested in Stella's answer in relation to that. Kieran?
Yeah, well, I mean, I echo Leighton's comments about artificial intelligence, but for me, I think what's exciting is actually the potential to get more out of the natural intelligence of clinicians and patients working across health systems globally, because connecting them, I think, we can stop some of the reinvention of wheels that's been happening. There's a lot of potential for sharing and collaboration that I think will come through the networks that are emerging.
Stella?
So I think two things, building on the panel discussion already. One is the increased use of technology for productivity. So the ability for us to automate activity that currently is very manual, and thinking about how technology can free up people to then be able to do more in terms of delivering healthcare. And the second is thinking about how we might use the really amazing technology and that's penetrating the retail sector in terms of the avatars or the technology that it seems like you're engaging with a person, either a chatbot or an avatar, but actually you're engaging with the technology. And if it's pretty routine, I think there's real potential for how that can go directly into people's living rooms and support how that technology will promote the nudged concept that Thorsten talked about in terms of how to encourage us to manage our conditions better or manage our own well-being better.
So on that note, so I work in technology and also with corporates, and so on that level I know how hard it is to integrate and also to get through the procurement process of being able to work with anyone. You all laugh. I guess you've all been through it. Stella, I know you've been quite successful in actually creating some meaningful partnerships and collaborations in getting technology into the medical system. Do you have any advice or do you have any perspective of, actually how do we work with technology companies in our medical system, given that some of them are startups or, we're handling people's data and their personal information and they need money and then there's a procurement system and sometimes people just aren't ready for that. Do you have any perspective on this?
Yeah, so in particular, I've focused on actually putting an innovation or a partnership clause into the procurement process so that when we go to market and we're looking for partnership or a solution, that we actually indicate that we're okay with having it as an iterative process that can encourage the technology to be better able to deliver what it is that we need. The other is that we have a mechanism through procurement where we can test a startup technology. They're bound by the same rules and regulations of any technology partner, but they get in the door to be able to work with a big DHB or a small provider to test how that technology might work. And we get a level of engagement that allows us to then think about, okay, what's the big space that we need to go in? And that's how we've been able to work with Sense Medical, for example, as a startup, and our partnership with Orion Health has also meant that we're getting to see that roadmap, see that technology early, and point out the opportunity for improving that technology in the way that the clinicians and the patients need to use it. So I think you can bake it in terms of your market process, but you can also have mechanisms that actually support that innovation space with industry partners. And I personally think the reality is industry need us as health sector providers to create space for them to understand how the technology can actually create value, and we need that partnership in order for us to be able to get the best outcomes for the dollar that we spend on that technology.
Awesome. Leighton, I'm going to come to you because you have a software development background, I think?
Yeah, so my background is engineering, so more on the technical side than clinical.
So I guess on that side, I kind of want to know is like, how can, I guess, other developers out there or technology folks kind of use their skills to actually make an impact in the health sector?
Right, I think just first I want to acknowledge Stella for her vision and foresight in that area, because that is a key part to allowing startups like ours to actually build product in partnership with a DHB to see these and iterate on these products kind of in situ. And I know that's not the norm for most DHBs across the country. So I want to acknowledge that because that's a key part of enabling this innovation. So that is the biggest challenge, is getting a foot in the door for a small company. And there are hundreds of talented developers and small companies in New Zealand that can be providing innovative solutions to governments and government departments, not just in health, but in every sector. And I think it needs that space that Stella just spoke about to enable that to happen.
Awesome. Okay, so I would like to know, maybe back to Stella, what are the challenges DHBs are facing in order to implement the beneficial technologies?
The first one is the investment. So every dollar we spend in the IT department, we're not spending on clinical services. So I think you need to be really clear about what is the return on investment, be really clear about how the technology is going to either have a productivity benefit or have a benefit to either individual consumers or the system as a whole. So I think the ability for technologists to articulate the benefit is a challenge. So I've come from a clinical background to become the Chief Digital Officer, and I think that has been extremely helpful in articulating the benefit of the technology to the executive and the board about why we need to invest in this way. So I think there's a skill set opportunity for DHB, in particular the tech team, to be thinking about how they articulate that. The other is we need to stop competing with each other. So we have a classic tall poppy syndrome, or it's not invented here mindset, and I see there's a significant shift in that. The South Island has demonstrated that 5 DHBs can collaborate, can have one platform, can have one group of partners and platforms to work with, and out of that deliver a much better outcome for the South Island community and demonstrate both efficiency, so we've taken out duplication of tests, real waste from the system, and because we have one platform and we're working together. So I think collaboration is our other challenge.
It's quite an inspiring sort of story and metric. So we've got about 2 minutes, so I'm going to leave the most meaty question to last, and we could talk about this forever. I think, you know, so many different backgrounds and an amazing story here. So talking about healthcare, it wouldn't be right to not talk about the mental health crisis going on in New Zealand right now. And, you know, Christchurch unfortunately has had its fair share of kind of trauma in the last sort of decade. So what I would like to know is, you're all from kind of different areas, how can we come up with meaningful solutions for our mental health crisis, and what should we be doing collectively to ensure that we have a better and brighter future in New Zealand?
I'm happy to have a crack at this one. And if you cast your eye back to the diagram that I showed, mental health is a great example where a holistic approach is required, as opposed to the sort of bopper-mole syndrome. We've got a structural issue in that the mental health system was designed for the most acute and most extreme cases. You know, we've all read the Mason report and the Commissioner's report, and we targeted at, I think, the top 2% of the population. And we can't help people lead better lives if we don't focus on the left-hand side of that diagram. And that means really digging deep into the community, their environment, what is going on in their lives in terms of employment, in terms of their social circumstances and everything else. And no avatar, no AI or other sort of high-tech thing is going to substitute for human kindness and engagement, and it has to be real engagement. You can use some of the digital technologies to deal with the information needs of somebody who's maybe just wondering whether they're depressed, wondering whether they're drinking too much and things like that. That's fine. But the coalface still is about human touch points and human interactions to help real human beings.
I agree. So I think that a meaningful engagement in how we tackle the significant issues around mental well-being is to think about the connection to each other. First and foremost, human beings need human beings, and to be okay with connecting with your community, and to be okay with also identifying those that are not as connected. It's generally when we're disconnected that the beginnings of a mental illness can emerge. I think the other is that it needs to be a community response. I think it's acknowledged that it is not just a health issue. It is not just for the Ministry of Health or the district health boards to resolve. It is a national problem, and it requires a whole community response. And there are some fabulous initiatives that could look at how cities could have a real focus on mental well-being and invest in community events, invest in supporting the socially isolated, being okay, having the conversation of how are you doing, and it's okay to say, actually, I'm not doing okay. So I think we need to acknowledge that. I also want to recognise that for Christchurch, there has been significant layers of impact, and it will be a multi-generational impact, and we need to understand that from a research perspective and a way of working which needs to be very different from what we've had to date.
Thank you so much. I do really believe that it is, should almost be community first, and that we can't blame our mental health system because it's kind of needs to be really holistic in its answer. That's all we have time for today. Thank you so much for joining us. I wish we could continue on, but unfortunately we can't. Thank you so much for watching Techweek TV, and have an amazing day. See you later.